There's a 15-minute window every single morning where your risk of stroke is higher than at any other time of day. Most people over 60 have never heard this. Their doctor has never had time to explain it. And there is a good chance that right now, without realizing it, you are doing at least one thing during that window that is working against you. Stick with me for the next few minutes, because this is not about scaring you. This is about 7 small, ordinary morning habits that quietly raise your risk, and the simple, doable fix for each one. Habit 6 is the one almost nobody catches, even people who think they are already doing everything right. So stay with me for that one especially. I am Dr. Robert Vance, and I have spent years working with patients over 60, helping them understand the small daily choices that actually move the needle on heart and brain health. Before we get into it, here's what we will cover. We will talk about why mornings specifically carry more risk than the rest of the day. Then we will walk through 7 common habits, one at a time, and exactly what to do instead. None of these fixes require a major life overhaul. Most of them take less than a minute. Quick note before we start, because I take this seriously. This video is general health education. It is not a diagnosis, and it is not a personal treatment plan. If you have high blood pressure, heart disease, diabetes, or a family history of stroke, please talk with your own doctor about your specific situation. Think of what I am sharing today as background that helps you ask better questions at your next appointment, not a replacement for that appointment. Let's start with the biology, because once you understand this, everything else makes sense. While you sleep, your blood pressure naturally drops. That is normal, and it is healthy. Your body is supposed to rest during that window. But in the hour or two after you wake up, your blood pressure rises again, sometimes quite sharply, as your body shifts out of rest mode and into action mode. Doctors and researchers call this the morning surge. For most healthy people, this surge is unremarkable and causes no problems at all. But for people whose cardiovascular system is already under strain, whether from high blood pressure, artery stiffness, or other factors, that surge can hit harder than it should. This is a meaningful part of why strokes and heart events cluster in the morning hours instead of spreading out evenly across the day. The 7 habits we are about to go through do not cause that surge. Your body creates that surge on its own every single day, and there is nothing wrong with that. What these habits do is make the surge more intense than it needs to be, or stack additional risk right on top of it, during the exact window your cardiovascular system is already working the hardest. Let's start with the first one, because it is the most common mistake by far, and you have probably done it again this morning. Habit number 1 is standing up too quickly. Think about what your body has been doing for the last 7 or 8 hours. You have been lying flat. Your blood has settled and redistributed itself throughout your body in a very different pattern than when you were upright. So when you sit up fast, swing your legs off the bed, and stand almost in one motion, your blood pressure has to make a rapid adjustment to keep blood flowing properly to your brain. In younger adults, that adjustment happens almost instantly, and you barely notice it. But as we get older, that reflex slows down, sometimes noticeably. Doctors call this orthostatic hypotension. For most people, it shows up as a brief moment of dizziness or lightheadedness right after standing. On its own, that is usually harmless. But it is also a clear sign that you are asking your cardiovascular system to do something abrupt at the exact moment it is already managing that natural morning surge. I had a patient a few years back, a woman in her early 70s, generally active, who mentioned almost as an afterthought that she sometimes had to grab the dresser for a second after getting out of bed. She had been doing it for years and just assumed it was normal aging. It might have been minor, but it was also completely avoidable. The fix is almost embarrassingly simple. Before you stand up, sit on the edge of the bed for 30 seconds. Just sit there. Let your circulatory system catch up before you ask it to support your full body weight. It sounds too easy to matter, but that short pause genuinely gives your blood pressure time to stabilize. Ask yourself honestly, do you actually give yourself that 30 seconds? Or are you up and moving within a few seconds because there is a routine to get through and the day is already calling? Most people I ask this question to have never once thought about it before. Habit number 2 is skipping water first thing in the morning, and this one surprises people because it does not feel connected to stroke risk at all. Overnight, your body loses fluid simply through breathing, and for some people, through sweating as well. After 7 or 8 hours without a single sip of anything, you wake up in a mild state of dehydration, even if you do not feel thirsty. Dehydration thickens your blood slightly, which means your heart has to work a little harder to circulate it. That is one more small stressor layered directly on top of a cardiovascular system that is already navigating that morning surge. This matters even more after 60, because your sense of thirst becomes less reliable with age. Your body might genuinely need fluids without sending you a strong enough signal to notice. So the fact that you do not feel thirsty in the morning does not actually tell you very much. I am not suggesting you chug a huge glass of water the moment your eyes open. I am suggesting you make rehydration part of your first few minutes awake, rather than something that happens by accident with your first cup of coffee hours later. A simple habit that works well for a lot of my patients is keeping a glass of water on the nightstand the night before, so it is already there, already within reach, before you've even fully opened your eyes. Habit number 3 is one that tends to generate some pushback whenever I bring it up, so let me be very clear about what I am actually saying. I am not telling you to give up coffee. I drink coffee myself every morning. What I am pointing out is that a lot of people go straight from a dehydrated, fasted, overnight state directly into 2 or 3 cups of caffeine on a completely empty stomach. Caffeine itself causes a temporary spike in blood pressure. For most healthy people, that spike is small and passes quickly. But if you already have high blood pressure, stacking caffeine on top of dehydration on top of the natural morning surge adds another layer to a pattern that is already working against you in that same narrow window. It is worth noting that this effect tends to be stronger in people who do not drink caffeine regularly, or who are especially sensitive to it, since your body adapts somewhat to a consistent daily intake over time. That does not erase the effect completely. But it does mean this particular habit matters more for some people than others, which is exactly why blanket advice like cut out caffeine entirely rarely makes sense for everyone. The fix here is sequencing, not elimination. Water first, then some food, then your coffee, rather than coffee being the very first thing that hits your system. Let me give you a concrete example, because I think it makes this easier to picture than just listing facts on their own. I had a patient, 66 years old, generally healthy and active, with nothing alarming in his medical history. He mentioned, almost in passing during a routine visit, that he sometimes felt lightheaded most mornings, right after his second cup of black coffee, which he drank on an empty stomach, usually within about 10 minutes of waking up. When we looked at his home blood pressure readings over a couple of weeks, they were noticeably higher in that early window than later in the day. Nothing dramatic, nothing that sent him to the emergency room. But it was a clear pattern, and it lined up almost perfectly with his routine of waking up, standing quickly, and drinking coffee before anything else. We did not overhaul his entire life. We simply changed the sequence. Water when he woke up, a small breakfast, coffee after, and a slower transition out of bed. Within a few weeks, those morning dizzy spells had essentially disappeared. So here's a question worth sitting with for a second. What is the very first thing that enters your body after you wake up? Water? Coffee? Nothing at all until much later in the morning? There is no wrong answer here. This is not a test. But it is worth actually knowing your own pattern, because most people have never once paused to notice it. Habit number 4 is something that does not even feel like a habit, and that is exactly why it is so easy to overlook. It is the mental stress of rushing. A lot of people, especially those still juggling work, grandchildren, or a full calendar, wake up and immediately move into a mental to-do list, checking the phone, reading the news, mentally running through the day's appointments before their feet have even hit the floor. That kind of immediate cognitive stress triggers your body's stress response, which includes a release of hormones like cortisol and adrenaline, both of which raise blood pressure and heart rate. Layer that on top of the natural morning surge, and your cardiovascular system is working overtime before you have even brushed your teeth. Picture your own morning laid out in order. You sit up fast. You are mildly dehydrated. You are already reaching for your phone to check overnight messages or the news. Your first cup of coffee is sitting there waiting. Individually, none of those moments would register as a big deal. But stacked together, in the exact same 15 or 20-minute window, they are asking your cardiovascular system to handle several small stressors at once, right when it is already managing that natural pressure rise on its own. This does not mean you need to meditate for an hour every morning, though if that appeals to you, it certainly will not hurt. It simply means giving yourself 5 or 10 minutes of a calm transition before diving into your phone or your obligations makes a real physiological difference, not just an emotional one. Habit number 5 connects directly to something a lot of people over 60 deal with every single day, and that is blood pressure medication timing. If you are prescribed medication to manage your blood pressure, when you actually take it relative to when you wake up genuinely matters, because it affects how well that medication is working during the exact window your body needs it most. Some people take their morning medication late, after breakfast, after running errands, sometimes not until midday, which means the medication is not actively protecting them during that early morning surge at all. There is also a common pattern I see where people take their medication inconsistently, close to on time some days, a few hours late on others, often without realizing how much that variability actually matters. Blood pressure medication generally works best with a predictable, consistent routine because your body's morning surge happens on a fairly predictable schedule too. When the two fall out of sync, you can end up with your medication's protective effect kicking in well after the window it was actually meant to cover. I want to be very clear here. I am not telling you when to take your specific medication. That is a conversation to have directly with your doctor or your pharmacist, because it depends entirely on which medication you are on and your individual health picture. What I am telling you is that if you have never actually discussed timing with your prescriber, it is worth asking about at your next appointment, because it is a detail that often gets skipped in a short, rushed visit. Let's pause here for a moment, because we are about halfway through, and I want to bring this back to the bigger picture before we keep going. None of these 7 habits, on their own, are dramatic or dangerous. That is actually the whole point. Stroke risk is usually not about one catastrophic decision. It is about a stack of small, ordinary choices, repeated every single morning for years. And the encouraging part, the part I really want you to hold on to, is that because these are small habits, they are also small fixes. You do not need a complete life overhaul. You need to notice the pattern and adjust the order. Now here is habit number 6, the one I mentioned at the very beginning. And it is the one most people miss completely, even people who are already doing everything else right. It is ignoring an irregular heartbeat, specifically something called atrial fibrillation, or AFib for short. AFib becomes more common as we age, and it significantly increases stroke risk, because an irregular heart rhythm can allow blood to pool inside the heart and form small clots, which can then travel to the brain. Here is the part that genuinely surprises people. AFib does not always feel dramatic. Some people do feel a fluttering or racing sensation in their chest, but a lot of people, especially in the morning, just feel a little more winded than usual, or notice their heart seems to be beating a bit irregularly while they are getting dressed, and they write it off as being tired or simply out of shape. I am bringing this up specifically in a video about mornings, because AFib symptoms often become more noticeable during that early transition out of rest and into activity, the exact same window we have been discussing this entire time. Someone might feel completely fine sitting still, and then notice a strange fluttering sensation the moment they start moving around getting ready for the day. It is easy to dismiss, because it usually passes on its own, and life moves on. But that specific pattern, noticing something and then immediately explaining it away, is exactly how a lot of AFib cases go undiagnosed for years. If you have ever noticed an irregular heartbeat, especially in the morning, that is not something to diagnose yourself off a video. But it is absolutely something worth mentioning to your doctor, because catching AFib early and managing it properly is one of the most effective tools we actually have for reducing stroke risk. Habit number 7, and this one ties everything together, is skipping breakfast, or more specifically, skipping it in a way that leaves you running on caffeine and stress hormones for hours at a time. When you do not eat, your blood sugar can dip, which triggers your body to release more stress hormones to compensate, which, once again, raises your blood pressure. It is the same pattern we have talked about throughout this entire video, small stacking stressors, all converging in that same morning window. I want to be clear that I am not talking about intermittent fasting here, which plenty of people practice safely and intentionally, often with guidance from their own doctor. What I am talking about is the unintentional version, running out the door, skipping food, not as a deliberate choice, but simply because there was not enough time, and then wondering later in the morning why you feel a little shaky or unfocused. That unplanned gap is exactly what tends to trigger the stress hormone response we have been discussing. You do not need an elaborate breakfast. Even something simple, eaten within an hour or two of waking, gives your body a stabilizing signal that says the stress response can stand down now. Now let's talk about a myth, because this is where I think a lot of unnecessary fear gets created. The myth is this: if I have any of these habits, I am in serious danger. That is simply not how risk actually works, and I want to be very direct about that, because health content online has a bad habit of turning nuance into panic. Having one or two of these habits does not mean a stroke is imminent. Stroke risk is influenced by a combination of factors, many of which build up over years, not single mornings. Things like genetics, existing conditions such as high blood pressure or diabetes, smoking history, and your overall cardiovascular health. What these 7 habits represent are modifiable pieces of a much bigger picture, small adjustments that, when combined with the basics your doctor already talks to you about, like managing blood pressure and getting regular checkups, can meaningfully lower your risk over time. This is not about fear. It is about awareness, because awareness is something you can actually act on, and fear usually just makes people freeze instead. There is a second myth worth clearing up quickly, and it is the idea that stroke is something that only happens to people who are already visibly unhealthy. That is not accurate either. Plenty of people who experienced strokes were active, ate reasonably well, and never considered themselves at high risk at all. That is exactly why understanding modifiable daily patterns, like the ones we have covered today, matters for essentially everyone over 60, not just people who have already been flagged as high risk by their doctor. I want to add one more thing here, because I think it is genuinely reassuring rather than alarming. Most of the major, well-established risk factors for stroke are things that are already being tracked at your regular checkups: your blood pressure, your cholesterol, your blood sugar, whether you smoke, your family history. Those numbers matter far more than any single morning habit ever will. What we are talking about today is not meant to replace that bigger picture. It is meant to sit alongside it as a set of small daily adjustments that work in the same direction as everything your doctor is already helping you manage. Here's the real insight I want you to walk away with today. Stroke risk is not primarily about one dramatic mistake. It is about the accumulation of small, repeated choices, and mornings happen to be a window where your body is already working a little harder, which means the choices you make in those first 30 to 60 minutes carry a bit more weight than the same choices would later in the day. Giving yourself time to sit up slowly, hydrating before caffeine, managing stress before diving into your phone, understanding your medication timing, paying attention to your heartbeat, and eating something before you are running purely on adrenaline. None of these are complicated changes. But together, they shift your mornings from a window of accumulated risk into a window of genuine protection. I would like you to think for a moment about which of these 7 habits describes your own morning the most closely. Maybe it is the rushed standing up. Maybe it is the coffee before the water. Maybe it is the phone before your feet even hit the floor. Whatever it is, I genuinely want to know. Drop it in the comments below, because I read through them, and seeing which habits are most common helps me decide what to cover more deeply in future videos. One more note before we wrap up, because I take this seriously. Everything in this video is general health education based on well-established patterns in cardiovascular research. It is not a diagnosis, and it is not personalized medical advice. If you have specific concerns about your stroke risk, your blood pressure, your heart rhythm, or your medication timing, please talk to your own doctor. They can look at your actual history and your actual numbers in a way that a video never can. If this changed even one small thing about how you approach your mornings, I would really appreciate it if you hit subscribe, because I am going to keep making videos exactly like this one. Practical, grounded in real research. No fear-mongering, just information you can genuinely use. And if you are curious about what else might be quietly working against you without you realizing it, in the next video, I'm going to walk through the surprising connection between sleep quality and long-term brain health, including specific habits that make a measurable difference as we get older. It is a conversation I think a lot of people need to hear. Until then, Take care of yourself. Start with one small change tomorrow morning, and I will see you in the next one.